Treatment of warts and methods to help prevent warts. Warts caused by the virus should be able to cure itself. However, for a long time, warts tend to spread more, so it should be treated as soon as possible. As a kid, you probably heard if you touch the toad skin will get warts. In fact, warts are benign tumors of the epidermis, caused by the HPV virus, human papillomavirus, that penetrates the skin through external scratches. Vaccination in wet areas such as fields, gardens, public baths, swimming pools, etc., will increase the risk of developing warts on the feet. How to spread toads. Direct contact with the patient's warts such as touching, rubbing, grasping. In addition, the disease can also be spread through the use of common items such as towels, shoes, clothes with acne sufferers. Glass. It is usually 2 to 3 months after exposure to warts to know if it is spread. Self-infiltration, jumping, on the patient's body, from the first few large warts, also known as mother's warts, they spread to neighboring healed areas or exposed skin areas, such as scraping, scratching, grasping, and creating more little warts. These bumps will develop and then continue to spread exponentially. The treatments. Because of the warts caused by the virus, during the course of the disease can be self-healing, leaving no trace for 6 months. However, this is less likely to occur, mainly in children. As long as the warts tend to spread more, it should be treated as soon as possible. There are many ways to cure warts in folk, but so far no method is completely reliable because many people have tried but failed. Take care of yourself at home. Choose the right shoes, fit, not too tight or too loose. Keep feet dry and change socks regularly. Use pads, in shoes, sandals, in places with warts to ease pain or discomfort. In addition, sandpaper can be rubbed on the acne surface to reduce the size and wartiness of the warts. Acid reflux. Small, dilated warts less than ½ centimeter can use salicylic acid and lactic acid, duofilm, Clomac. The drug will destroy, flack off the horny cells along with the virus in the wart. However, it may take several weeks for the warts to completely disappear. Patients should be able to use these preparations at home, and should be thoroughly cleaned with soap prior to topical application. Lightly brush the surface of your hand warts or grinders, nail files, to remove the dead skin cells from the previous day. Apply to the surface or to the root of the wart. The drug will dry quickly and leave the drug white. Avoid spreading the skin around the skin. Apply once a day after bathing. Cover the bottle cap immediately after application and leave in the cool place because of volatile medicine. Be careful not to use this medication yourself when it is associated with conditions such as diabetes mellitus, cardiovascular disease, peripheral circulation disorders, and bacterial infections. Liquid nitrogen, usually divided into several batches, each 1 or 2 weeks apart, will produce good results. Some people completely out the drug used as nitrogen gas in liquid form, so the temperature is very low. This method leaves little scarring or pigmentation in the dotted position but is often annoying, can float and hurt for days after dipping. Electrocardiography, apply to the warts less than 1 centimeter or in the area of minor surgery, e.g., at the toes of the toes. Warts will be removed by high-frequency, electricity. The advantage of this method is quick, simple, inexpensive and can deepen the warts. The downside is that healing time is longer than minor surgery, open wounds susceptible to infection, bleeding in large wounds that are not hemostatic, and wound care must be more thorough. Minor surgery, local anesthetic, apply to large warts, under 2 centimeters in size and in a flat, heel, foot, soles. The advantage of minor surgery is that healing time is faster than electrical burning. Post-operative wound care is easier, less susceptible to septicemia but higher cost, more likely to recur due to not getting rid of acne. Toads are and can leave scars. Injections of topical bleomycin or interferon injections in case of large warts are difficult to treat. Note: do not rupture or drain fluid on the surface of a liquid nitrogen wound. If you have symptoms of swelling, redness, pain and discharge or pus, foul odor, high fever or chills, the wound is infested, need antibiotic treatment. Sometimes warts come back quickly because the mother's warts have spread the virus and created acne in the surrounding skin before they are treated. These warts are so small that they cannot be seen as they appear. Therefore, Treatment of warts should be promptly detected early to prevent autoimmune disease. Patients should be instructed to self-monitor daily for 2 to 4 weeks at old lesions to detect any recurrent symptoms. Retreatment, acid, nitrogen, electrolysis, minor surgery, as quickly as possible but with recurring lesions before the virus can further infect the surrounding skin. In special cases, it is only necessary to treat mother warts several weeks after the child warts disappear without the need to intervene. Thank you very much.